Hi, good evening, everybody. Welcome to another online session of Lahore Literary Festival's ongoing digital talks. I will be moderating the session tonight. My name is Vijaya Haider. Tonight, we're so very excited to be in a conversation with Dr. Saad Shafkat. Welcome, Saad. Thank you so much for being with us here today.
Thank you for having me. It's a pleasure.
So excited to be doing this tonight. So Dr. Shafkat is a professor of neurology at the Al Khan University. He has written cricket columns for Cricinfo and Dawn, among other publications, and has authored 2 books as well. He co-wrote his first book, Cutting Edge, in 2003. It is an autobiography of Javed Miandad. He followed this up with his medical thriller, Breath of Death, the book that we'll be discussing tonight. This was released in 2013. His latest work, Rivaled, will be released as soon as the pandemic is over. So Breath of Death, Saad's first novel, is gripping page turner, which deals with a lot of things that are, many peculiar issues of our times, like terrorism, biological warfare, terrorist organizations, you name it. It is perhaps one of the first medical thrillers in Pakistan, written by a Pakistani author, and an intricately woven tale that you do not really want to end. So the first thing that I would do to start off, Dr. Saad, if I may.
Please do, Saad, yes.
So you are a neurologist, and of course, time is a luxury. How do you find the time to write, with such a busy schedule and everything? I mean, it's so difficult to find time to write, even in normal circumstances. So with such a busy schedule, how does it happen?
Vijaya, thanks. That's I guess I'd say that I think it's a good thing to be busy, because when you're busy, you're always looking for something to do. You're sort of in the flow of things. You don't need to work up any activation energy. So if you're busy, I think you keep doing stuff and you find the time. I'd also say that I'll be perfectly honest, I'm not very disciplined about my approach to writing. So I've taken a lot of time over it. The cricket columns have come very naturally because I just really so much enjoy the game. But the book with Miandad required a lot of discipline, and my wife was the one who was, cracking the whip. Okay, this is now your slot. The kids have gone to sleep, and you were a young family then, and now please go and sit on the computer and crack out at least a chapter. And so, but the fiction book, this Breath of Death, I wrote it over several years. I think probably 7 or 8 years. Mm-hmm. And as you're saying, there are other commitments and other obligations. So I would really do it. I'd really come to it only when the mood struck me. Yeah. And then I would go sometimes weeks, sometimes even months without touching it.
Yeah, because nonfiction is, of course, nonfiction is difficult, but fiction is a different beast altogether. So did you enjoy writing it?
It was such a thrill, to be honest. And what I really loved about it the most is how you can just keep making it up. And it's like if there's a room you have to construct and the room somehow isn't coming together, well, you convert it into an open field. If there is a male character that has to enter the story, but somehow the masculinity is awkwardly placed within the narrative, then you make it a woman. And so I did the freedom to just create. I really enjoyed that part. And then I think all of us as human beings, we are very natural storytellers with the gift of communication, the gift of language. And I think once you've been inclined to tell a story, it can be a lot of fun.
True. So when I read this novel, I learned so many things about stuff that I normally wouldn't have made a conscious effort to learn if I wasn't given it in a story, in the shape of a story. Especially that chapter about epidemics in Pakistan, which discusses various viruses that Pakistan has had to deal with over the years. Do you think that sometimes fiction is a better way to make people learn about different technical issues that they might not have, that they might not want to acquaint themselves with otherwise? Especially in a place like Pakistan, where there is already a lack of, awareness, general awareness about health issues. Do you think that a thriving medical fiction scene could help create general awareness about these issues in Pakistan?
I think that's a fantastic point. If there's information that has to be packaged and you can package it around a story, a human interest story, that really gets very easily embedded within the mind, within the psyche. So I think even if you were to, for example, do public speaking, or you were to hire some very expensive consultant who wants to help you with public messaging, they would all recommend that you make use of stories in what you are trying to communicate. So I think absolutely fiction is an extremely powerful device. And there is a saying that you can get away by saying in fiction what you can't say really in nonfiction sometimes. So I think even difficult messages that have to be communicated or that have to be brought to light can be done through fiction. And there is, of course, a double-edged sword, because you could also spread misinformation through fiction. So one has to be careful how you are processing that narrative.
Hmm. Because there were so many things in that chapter, and overall the book, I really found a lot of things interesting, and things that added to my knowledge, things that I did not have any idea about, like the various kinds of viruses and stuff like that. Really interesting stuff. So another thing that jumped out at me was the absolute realness of the characters. The fact that you could, absolutely relate to them, not just look at them like through the window, but to be in the room with these doctors while they are discussing things, different subjects, different patients. You keep hearing about doctors' predicaments, especially in today's day and age, with the pandemic around and everything. How difficult it is for them to work, how the various difficult situations that they're working in. You read about it in newspapers, but it does not hit you the way it does when you read a story. And fiction is pretty powerful in that sense. I think it really is. It really changes things for you.
Very much so.
Yeah.
Yes.
Yeah. Yeah. Please go
No,
on.
I was going to say, just building on that. Certainly the medical profession. There's a lot of strain on the medical profession. There's a lot of demand. The consumer side of the profession, the patients and their families, they become very knowledgeable, and a lot of information now is also quite easily accessible. And sometimes if you process that information in a raw fashion, then that can create misconceptions also. So sometimes you have to unlearn before you can properly learn. And so all of these things are making it difficult for, I would say, the doctors to do their job. But at the end of the day, it is of course an essential profession, and we all need to be healthy. And at the end of the day, it's still a very rewarding and a very fulfilling profession in many ways, because the stakes are impossibly high. Stakes can't get higher than life and death. And then it's intellectually very challenging. And then, excuse me, just the ability to be able to help someone in need, if things work out, that can be very special. The point embedded in your question also partly is that, being a doctor and being part of the medical profession, how do you convert that into fiction? And I'm very pleased what you said, that you found the characters very real and you could relate to their experiences. I think that one really has to fight as a doctor, if you're writing about your work and your life, you also have to fight the curse of knowledge, because you kind of, in a way, know too much, and you don't want to overload the text. You don't want to overload with details, with the arcana. So I was very conscious that I really wanted to I really wanted to write in a way that it wouldn't get boring, that when somebody is reading the narrative, there would be enough technical stuff that a reasonably educated person could absorb, but not enough that it would bore them or the eyes would glaze over. So you really have to give a balance. It's very tempting to flood it, of course, with a lot of the details, but that would definitely be counterproductive.
Definitely, and that will make it boring as well, actually, because the story has to be. So, most of the characters in the book are struggling against their circumstances. But one thing that I noticed is that you present the characters as they are. Like, you observe them and you write them as they are. You're not attempting to make excuses about why they're behaving the way they are, or why they in particular situations. You just observe these characters and you're writing them. There is like the antagonist, especially the antagonist. Something that probably a writer like Manto was known for, that is writing the characters as they are. What are some of the things that writers who want to experiment with this genre can keep in mind when while assembling an orchestra of characters, meaningful characters in their book, if they are to experiment with with a medical thriller?
I think the most important thing is that the character has to be believable. And the way to sketch a believable character is either to base it on someone you know. It doesn't have to be one person, it could be a composite of 2 or 3 or more people, but something that you've experienced in real life that is being conveyed through the character you've created. And apart from that, I think if you try to add judgment or you try to adorn the character, you lose the message and you lose the picture you're trying to create. So I really take your point when you're saying that they should be observed as they are. It's almost like you've got a canvas and you've slapped some paint on it in a certain way, and then you just stand back and you let the canvas itself do the talking. If you keep fiddling with it too much, it just the dish will spoil. So I think the believability and then not tinkering too much, that would be my approach.
Sure. Yeah. What I generally love about medical thrillers as a genre is that you can just take a nugget out of the medical profession and you can spin a whole tale around it.
Yeah.
And it's just amazing, a small portion, and just amazing tale around. Everything is around that, is going around that one thing. Why did you did you decide to dive into the world of medical thrillers, apart from the obvious fact that you yourself are a doctor? What was the exact point that you decided that you wanted to do this? Like,
that's a wonderful question. I'll have to, if I look back. So I was finishing. You in young adulthood, you're very busy with studies and trying to get your profession started. And I was in the US for advanced studies for close to a decade, and I came back in 2000. And when I came back, I was obsessed with doing Miyada's book, because having been a Miyada fan, I kept waiting for Miyada's book to appear. I really wanted to read about his life's experiences, and there was no book. And when I came back to Pakistan in 2000, I tried to get in touch with him, and I figured, maybe I could write it. I didn't have much experience, but I figured, how hard can it be? And it was a lot of fun. We connected, and the chemistry really worked out, and we're wonderful friends now. So once that was done with, I was concentrating at work on my medical work, and then I'm in a teaching hospital, so you have to look for academic promotions and so forth. So you're quite absorbed with that. But I started realizing that something was missing, and I really wanted to do something new and something different. And I had given thought of another cricket book, but I thought maybe let's just, the two things I know. I mean, I enjoy writing and I know medicine. So why not just put those two together? And I just didn't feel the urge to, it was as much fun to do something nonfiction in medicine, like a textbook or a monograph or something. It's just the idea of doing a fiction book that includes, that incorporates the medical profession. It just seems so, so enjoyable. And so I embarked on that, and when fits and starts to product showed up. So why did I guess just it seemed like a lot of fun.
It turned out well.
Thank
So
you.
the virus in the Breath of Death, basically in Breath of Death, your novel, is actually much deadlier, and it's more transmissible than COVID-19, the thing that we're facing right now, because it's airborne. The virus in your book. How did you come up with the idea of making this virus as the central theme of your novel?
Yeah.
I mean, in a way that you completely nailed that part.
So I wanted to create an infection. It has to be an infection because it has to be transmissible, since you want to, if it's a bioterror weapon, you want to impact as many people as possible. And it had to be deadly. So, the deadliest diseases known to man, known to humanity, are the ones affecting the brain. And then being a neurologist, that came naturally. And then the most transmissible diseases are the ones that are spread through the air, as we are seeing with COVID-19. For example, HIV or hepatitis B, these are also very transmissible diseases, but you can't get HIV by sitting next to someone and having dinner with them. But you certainly can. That will certainly happen if you have dinner with a COVID-19 person, especially one who's coughing and not wearing a mask, and you're not. So the transmissibility, for maximum transmissibility, it has to be a disease that spreads through the air. And I was aware that there is this brain virus that causes a very deadly, lethal inflammation of the brain, without giving away too much. That does have, in certain cases, it is usually transmitted by, through an animal bite. But there are some cases where people have acquired this condition without having any known history of an animal bite. And the thinking is that they probably got it through the air. And so I just tried to put those two things together and then come up with a lethal brain infection that you could catch just by breathing. Hence the title.
It was really scary as well, because rabies is just known to be transferred through an animal bite, and it was extremely. Yeah. So the novel has been written in the backdrop of 9/11 and its repercussions. Of course, because it was written in 2013. Many of the novels around that time were written around this theme. Now that we are facing this pandemic and living in very strange times, do you think that that fiction, after most fiction that is going to come after this, is going to be coming out of course, it's going to be written in the backdrop of this pandemic? And do you think that there will be a rise in medical thrillers in the country? And more new writers might be willing to take up medical thriller as as something that they would want to do. Do you think that do you think that this is going to increase, the medical thriller, the genre? Of course,
very interesting question. So, for example, how will the COVID-19 pandemic influence fiction output? I'll be honest, I don't find the COVID-19 pandemic, I don't find as interesting because it's affecting the whole planet. You need some sort of pathos, you need some sort of unfairness, some injustice, some kind of special misery that you can create an interesting story from. If it's affecting everyone, if the richest people in the US are as affected as the poorest people in the slums of Bombay, it doesn't really, I don't see it doesn't really strike me as a very fertile platform for, new fiction stories. I mean, some of it obviously will. And I think also the other thing is people are kind of tired of it, really tired. And we just we don't want to be reminded of it. We just want it out of the way. But what was something like 9/11 and what that did to the Muslim world and what that did to Muslim immigrants in the West, that is something that generates a lot of churn and a lot of angst, and that can certainly provide leads for creating very interesting stories. But I don't
True,
see the
because
same thing happening. I don't really see the same thing
in
happening with COVID-19.
but do you think a general increase in medical thrillers, a general, rise of, interest in
I think
medical thrillers?
certainly, yeah. Yeah, I think
Because,
that is a,
yeah,
yes. Yeah, no, I
because
think you're
you,
right. That's the second part of it. Go ahead.
hmm,
No, no, finish
because
your thought.
you have probably, written the first medical thriller in Pakistan. I don't think that anybody else has really,
I've been told that, and that's
I don't
quite a
think so.
compliment,
Yeah,
yes.
yeah. So, and it's quite interesting, because it's that a genre that has not been that has not been experimented with in this country. So yeah, that would be amazing to see if more writers are going to join in and write about write medical thrillers. Your
No,
book
no, I
came out
did,
in
but
two in yeah, yeah, please.
just to finish that thought. So I do think that so people have become very knowledgeable about medicine and medical issues during the pandemic. And I think there is a huge appetite now to know and understand clinical issues, biology, medical issues more and more. So certainly, I think there will definitely be a bump in both fiction and nonfiction. Perhaps not. I mean, you can very easily overdo the pandemic template, but I think in other areas, I think people will definitely be very interested in reading about medical issues.
Right. So your book came in 2013 when things were very different and there was no pandemic, of course, and we could certainly not relate to the repercussions of biological warfare as well. Of course, we have you seen an increase in the demand for your book now that we can relate more to what happens when disease wreaks havoc on the world?
Um, I have, so a lot of this also has to do with just how books can get marketed and the supply chain dynamic and availability, accessibility. For example, this book is not available as an ebook. And that's also sort of, reflects on the relative infancy of the publishing industry, certainly in Pakistan, but even in South Asia. And so I think that if it were to be made accessible, I think, yes, there would be a bump, people would get interested and they would read about it. I haven't heard of any, I'm sure every now and then I do see it in bookshops locally. I don't know if people have even been able to go to a bookshop lately. So it's all been online and then then again, it just depends on how the publisher is positioning or the bookseller is positioning your book.
Okay, one question that I had to ask I have to. So we saw this, so your novel deals with the repercussions of biological warfare, of course. We saw this for the first time, as laymen when we were introduced to, anthrax. So the case of anthrax, of course, that you have discussed in your book as well. Currently, however, we are in the middle of a pandemic, and there have been some conspiracy theories around COVID-19 about the possibility of it being man-made. If and did you, for a single moment, entertain the idea of any such possibility regarding this particular predicament that we are facing right now? How do we really differentiate between a virus that is natural and one that has been created in a laboratory?
Yeah, very interesting question. Another one, bit of a googly, I'd say. Vajiha, I think there's two issues. One is the purely scientific issue, which is that you can't rule out the possibility of a synthetic creation. We do have very advanced technologies, biotechnologies that allow us to tinker with genetic codes and with protein and molecular content of microorganisms. And you can mix and match a number of things. So one can't rule that out. But the way it's behaved and people who know about viruses, very experienced virologists. They say that if you had to design something, it wouldn't look like this. There are things in it that don't make it an automatic choice for, in terms of if you would just design it. The way it's behaved, yes, certainly. The way it's behaved, it is quite transmissible and it has a certain lethality. But if you were to really start from scratch, start from the drawing board, you might make some changes to it, make it look exactly like the way it is. So that suggests that this is probably a natural occurrence. The other thing is that, if you start thinking that way, then your mind very quickly slips into a very unhealthy state of, existence, where you're just looking for demons around corners, and you're watching your back, and you could easily slip into a paranoia. So I think one has to take things at face value. And the good news is that we have done very well, relatively well, Pakistan especially, relatively well with the pandemic. Increasingly, we're finding out that, yes, it is a potentially lethal virus, but the mortality rate, the number of people that it manages to kill as a proportion of the ones who it infects, is not that high. It could be just as much as, less than 1%, maybe maximum 2, 3, 4, 5% in people who are vulnerable, like the elderly or people who have additional diseases. So I would take the good. I would focus on the good parts that are happening, which is that there is a declining trend in many places. We do know that we do know very clearly that precautions, very simple precautions like wearing masks and good hygiene, that will prevent you from getting the infection. And I'm sure there are obviously some innate biological factors, and there are also other environmental factors like heat. I think the heat has helped us in a certain way. So I would say I don't buy the idea unless some very convincing evidence is presented that this is something that was artificially created. It's sort of like, if I were to take a cricket analogy, it's sort of like, when Pakistan loses, it's like, oh, spot fixing thi, match fixing tha, oh, the boys, they threw the match. And so, unless there's actual hardcore provable evidence, I don't buy it, because it completely destroys your experience of the game. It undermines the morale of the team. And so in terms of the COVID-19 pandemic, most likely from all available evidence, a natural occurrence. And, if we were to just keep doing simple precautions, we'll fight this through, and hopefully before long, there's going to be a vaccine.
So, as you said yourself, Pakistan has actually done very well with this, pandemic. What are the reasons? What do you think are the reasons for this?
I think one, certainly the heat, because if you look at the trajectory, it was going steadily up, and then late June, early July is when it peaked, and then from then on, it's been downwards. And temperatures across the country have been in the high 30s, low 40s on many days. So that's certainly one. I think also there's been a very effective messaging campaign on the part of the government, provincial governments as well as the national government. When you go out into I go out into Karachi, I don't see many people wearing masks and observing distancing, but it's better than the baseline. So clearly something has kicked in. People are more careful. When we see them, they don't look that careful. But when you compare it to, through memory, what it typically is like, let's say a year ago, clearly people are being more careful and being more vigilant and being more aware. So I think that has also, behavioral change has also made a difference. And then there are some other, I'm sure there are some biological factors that we don't have a very elderly population. Mostly our population pyramid has a very broad base. So many people are young, and young people we know handle the virus a lot better. There are probably some other factors that will become obvious when people study this in great detail in the months, years, and years to come. For example, I have a feeling that in the West, there's a lot of nursing home populations that have not had the best ventilation, and nobody's really been looking out for them. And the people who are caring for them, the families aren't available. And so I think, no precautions were exercised. So these kinds of pockets, And sometimes I also wonder about subway systems. For example, you're in a subway car, you're far below the ground, there's limited to no ventilation, and you jam packed, cheek to jowl with number of people. Somebody coughs in one corner of the subway, it's going to affect somebody far away in the other corner, and an aerosolized transmissible virus could really rip through that population in a box subway car. And we don't have something like that. We do have crowded buses, of course, and we do have crowded trains, but there's a lot of ventilation and outdoor exposure. We know from a lot of evidence that indoor exposure is a lot worse than outdoor exposure. I think these are some of the factors that have helped us.
Very nice, very interesting. So coming back to the book, I really want to know what happens to Malik. Actually, I mean, we know what happens to Hamza in the end, but we don't know anything about Malik. Can we expect a sequel, sometime soon? Have you thought about, writing a sequel to this? What happens to Malik? Poor Malik.
No,
I don't know.
right. No, I haven't thought about writing a sequel to this particular book. Rivals is also based in a hospital, but it's not about terror or anything like that. It has to do more with complex human relationships. What happens to Malik? The thing is that Malik is from the world of jihadism. He's from this world where you've taken the message of our beautiful and beloved religion of Islam and contorted it into anger and violence and disruption. And so what happens to him? I deliberately left that open-ended because it really wasn't something I wanted to interface with too closely. It was enough to simply have him displayed as just an angry and hostile character who was intent on causing harm through violence and mass violence at that. And that's the reality we've seen again and again in our society and societies around the world.
True. One final question. Basic. It's very generic, of course, but I think very important as well. What would be your number one tip for writers who want to dive into the world of medical thrillers? And do they really have to be doctors to do so, or anyone? Could anyone take it up?
I think you have to have a reasonable amount of medical knowledge. Otherwise, if you start doing the research, it can get very confusing if you don't have a familiarity with the subject. What would be my advice? I think probably the advice would be just a generic advice for starting out in fiction as an initiative. I think you have to have this is how I come to it. I have the whole story in my head in the big broad strokes. And I think you have to be able to write it down in 1 or 2 pages, maximum 3 pages. If you can write that whole thing down, and then it's just expanding it bit by bit. And you don't always have to stick to the original map, the roadmap that you've come up with. But at least once you've got the overall framework, it just gets easier to start filling it in and start putting the pieces together. So I think if you're able to do that, and then you've got a wonderful starting point. And the other advice I would give is but I would say it's essential to write from the reader's point of view. So put yourself, when you write a page, put yourself on the other side and see what would it feel like if somebody were to read this page. Would they find it interesting? Would it flow for them? If it's flowing for you as a writer, you're probably getting it off your chest and you're enjoying it. But somebody else has to consume it. And so from the consumer's point of view, one should write from the consumer's point of view, because that is the individual. The reader is the person you are catering to. And it takes a certain amount of effort. You have to keep up the flow. You have to make sure things don't get boring. And you have to, so if you take care of all that, I think you'll have a fantastic product.
Perfect. So Saad, thank you so much for being with us, being here with us today. It was a pleasure to have this conversation. And I really learned a lot, about writing a medical thriller. And thank you to everyone who took out the time to listen to our conversation. I had an amazing time. So I guess we'll be signing off now. So,
I loved your
thank
questions, Vajiha. Fantastic, fantastic questions. Had a great time.
thank
Thank
you
you.
so much. Thank you, Ji. Thank you. Okay, Ji. Bye bye.
All right.